name is Rachel Cheek, a nurse education student at Auburn University. Today we're going to talk about the pharmacological class of medications of cholinergics. There are three categories of drugs in this class: muscarinic agonists, cholinesterase inhibitors, and ganglionic stimulants. Because of the wide variety of indications for cholinergic medications, we're going to primarily talk about muscarinic agonists today. There are 5 drugs in this group: myocol, carbachol, pilocarpine, bethanechol, and methacholine. Cholinergic agonists promote or mimic the action of the neurotransmitter acetylcholine, which activates muscle. When muscarinic receptors in the body are activated, acetylcholine is released from the parasympathetic nervous system, which then modifies targeted organ action. Muscarinic agonists are used clinically to treat glaucoma and also improve the tone of the urinary bladder and gastrointestinal tract. Absorption. Oral preparations such as bethanechol are poorly absorbed in the GI tract. Ophthalmic preparations, however, have a rapid onset and are absorbed in the eye. The distribution of these medications is unknown, and is also unknown the metabolism and excretion of bethanechol. Popular ophthalmic preparations such as pilocarpine, however, is metabolized by the neural synapses and excreted in the urine. Precautions. Cholinergics, especially muscarinic agonists, are pregnancy category C. Also, caution should be advised for lactating mothers. Oral bethanechol and subcutaneous bethanechol, the use in children has not been established by the manufacturer, thus it is considered off-label. Ophthalmic preparations, cautions with those include retinal disorders and primary congenital glaucoma. Contraindications include hyperthyroidism, peptic ulcer disease, intestinal obstruction, urinary obstruction, bronchospastic disorders, hypotension, bradycardia, cardiovascular disease. For ophthalmic medications, hypersensitivity, acute iritis, and pupillary block glaucoma. Adverse drug reactions. These are rare with oral preparations such as bethanechol, but more common with the subcutaneous form. Other adverse reactions include abdominal pain, nausea, diarrhea, flushing, a sense of warmth. With ophthalmic medications include retinal detachment, blurred vision, ocular burning, and staining. We should also be aware as providers of that muscarinic poisoning is possible with overdose of these medications and also with the consumption of certain poisonous mushrooms. Symptoms of this include abdominal creeping, excessive salivation, flushing, nausea, and vomiting. Drug interactions include cholinesterase inhibitors, which have additive effects, ganglionic blockers, which could induce potentially severe hypotension, and also medications such as quinidine, procainamide, chlorpromazine, thiazide, diphenhydramine, and promethazine, which also could have antimuscarinic effects. Indications. Oral and sub-Q bethanechol is used to improve urinary bladder and gastrointestinal tone. Oral pilocarpine is used to treat xerotomia, and ophthalmic medications are used to treat glaucoma. Rational drug selection. Bethanechol is prescribed either sub-Q or oral, used to improve urinary bladder and gastrointestinal tract tone. The minimum dose is recommended to achieve effective results, and the dosage range for adults is 10 to 15 milligrams 3 to 4 times a day. Ophthalmic preparations are chosen based on the type of glaucoma and a patient's underlying medical conditions. These patients should be monitored for nausea, vomiting, dizziness, wheezing, or other breathing difficulties, blood pressure, cardiovascular status, intraocular pressure, and also we should be aware of toxicity symptoms. Patient education. Bethanechol you take 1 hour before or 2 hours after a meal on an empty stomach. If subcutaneous bethanechol or ophthalmic medications are prescribed, correct medication administration should be taught. The patient's vision may also become temporarily blurred following the administration of ophthalmic medications. These patients should arrive slowly, do not exercise in the heat, stay hydrated, be caution with driving, take as directed, and of course do not abruptly stop. Main takeaways. These medications are contraindicated with bronchospastic disorders such as asthma or COPD. They could result in bronchoconstriction. Be aware of the possibility for muscarinic poisoning. Atropine is the antidote. Pediatric dosing of bethanechol is considered off-label. It should not be prescribed by a nurse practitioner. Glaucoma, there's increased intraocular pressure by the eye. Hopefully, with my helper, my daughter Mary Michael, will show how these medications can help decrease the pressure behind the eye and improve urinary tract and gastrointestinal tone. Thank you.